Mana Moore is one of the best project coordinator of Dr. Aida. Ihana be motivation sabi siya kapasla, inspirasyon.
Inspiração hetang si Dr. Aida. Aprende buat barak si Dr. Aida, no? Mesti sekolah.
The motivation from her is because she admired Dr. Aida a lot, and she knows that Dr. Aida is a strong woman, so she believes that if Dr. Aida can do it, she will do it too.
I study in University of Unpas in Faculty Public Health in Delhi.
So she had the experience in giving medication with the patient and in the community health. That's why the job for her with Dr. Aida is really relevant.
The clinic. Dr. Aida from Delhi comes out here with Frontline once every month. Dr. Aida has about 80 or 90 patients here regularly, and she keeps good records, medication, vaccinations and so on. Some of the medication for TB and also for HIV is subsidised by the Timorese government, so that's not a cost. Southeast of Delhi. Dr. Aida has just finished up with a program of community medicine. So, Doctor, I understand that you came back to Timor in 2005, and before that your family had suffered under the Indonesians. You somehow managed to make it to Connecticut to study.
Yes.
Can you tell the story?
I did, yeah. I was in a medical school in Indonesia for 3 years. Back in 99, I was in my third year. East Timor got independence from Indonesia. I could not go back because of the political reason. I came back to East Timor, helped out at Bairo Pite clinic. There was a group from Yale University that came and did research on malaria. I got to help with translation, and that's how they got me a scholarship to go study in the United States.
Well, this is quite something, you know. You could have, with your background, you could have been the Minister of Health by now. And yet you're committing yourself to rough roads and rough food and rough nights.
It's a very good question. A lot of people ask me that, you know, giving my background, and someone's got to do it, not me, you know.
We're just outside where the mums come in with their babies for postnatal care to get injections, and this is great that quite a lot of mothers have been coming in, and the clinic is keen to promote this.
Oh, this is the mother with 7 children. Yes, 7 babies. This is the mother. Naran said it? Her name is Filomena Ruas.
Does she want to have 14?
Senhora não se hakar kita bebê hakar to 14, 14 kan? She said she'll be dead by then. 14 babies is too much.
So what is the right number?
Então, número lolos ini karak ni hira. 8 is the most. 8. There's still one waiting. Huh? Now she said after this one, no more.
So this is the delivery room of Bairo Pite clinic where the women get delivered. Then after that, they wake the babies, and yeah, they're doing here. The lay midwives, trained midwives, doing the. We have oxygen, sanction, bulb syringe, and this is for the incubator. Not really as other country incubator, but at least we have.
Chantal Hemsley. I'm a fourth-year medical student from the University of Vermont in the States. This is my first sort of international medical rotation. It's a whole different world, it really is. You know, I've had to completely change my differential for different symptoms. You know, somebody comes in with, you know, shortness of breath or, you know, even problems urinating or, you know, gastrointestinal. It's, you know, you have to think infectious here, whereas in the States it's more chronic disease. And Dr. Dan is a great teacher, so.
Here now with Sion. She's a medical student from University of
Texas? Houston.
What's Texas like?
Oh, it's big.
And the college itself?
Because it's located right in the middle of the largest medical center in the world. So we have a variety of hospitals, Texas Children's Hospital, MD Cancer Center. So it's a privilege, but it's nothing like learning from here.
Okay, so Sion, what inspired you to come from one of the most sophisticated, well-equipped medical centers in the world to one of the least well-equipped?
Well, for me personally, it's been a lifelong journey. I've always been kind of compelled to share the love of God with
Now,
other people.
Dr. Choi, I understand you're a volunteer on occasions. You can here.
I'm a U.S. trained internal medicine doctor. I studied at Boston University.
Okay. And what are some of the challenges that you face in this kind of environment?
I mean, there's a lot of good, but a lot of challenges as well. I think sort of the thing that comes to mind are the lack of diagnostic tools. I think in the U.S. you get used to having all kinds of tools, laboratory, imaging-wise, to really assist you in diagnosis. And here, there's really a very few things that you can actually test for. And I think not knowing exactly what you're treating, but rather sort of taking a best guess using your physical exam skills, that's hard for an American doctor.
What is her name?
Martina, yes.
Martina. So, can you just? I'll ask Martina some questions.
Yes,
You
and
can
then I
translate,
can.
okay.
Okay, no problem.
So, Martina, you've been here for how long?
Martina, Kulahiran.
Pulan Ruan.
Yes, she's been here for 2 months.
And what part of Timor are you from?
Parte nebe Timor, parte nebe maitamai, mais parte nebe.
Manusia Ermera Tuliani.
Ermera, she came from Ermera, Hatulia.
Okay. And what is Emera like? Can you describe, for somebody who's never been to Emera, what's Emera like?
Hani sa Ermera que sidang pa Ermera, konta tok Ermera ne saida magdia Ermera.
Sa Tuliani. Ya amnyal diani.
La dundia.
Ya. Ya amnya sukuni.
Where they live, the village where she comes from, it's not quite developed, so she doesn't think people would like to come to Ermera, to where she comes from.
And I hear you learn very much in 2 months already. Yeah. What is your secret?
Yo le dia kata ano serviço makasi aprende bara que pulang ruan nilana ne. Segredo sai dai aprende ne hapus ne be maklalais ne.
Lucy Praterni. Ansa mai
Yeah, the secret is just the practice. She learns quickly because she practice more. That's why.
So I'm Jeffrey. And then I go to Rush Medical College in Chicago. I actually hadn't really heard a whole lot about East Timor before Josh, my friend, told me about it.
Joshua?
I'm a M2 medical student at the University of Iowa and just spending my summer here learning.
You know, as a first-year medical student, you can't really do a whole lot as far as contributions of knowledge. One thing you can do is, you know, help patients be comfortable, help explain. Not quite an exam. We're just, you know, before Josh and I leave, we're having a, you know, nice 1-hour lunch, not lecture, but Q&A about tuberculosis. TB is a disease that is, you know, highly infectious, but TB actually can be hematologically spread or spread throughout the blood, much like a cancer can be. You could see TB of the adrenal glands, TB of the prostate, TB of pretty much anything. So really, we see patients with TB pretty much everywhere.
I'm a paediatric nurse. I'm an Australian. I finished my degree about 3 years ago, and I'm doing my Masters in International Development at RMIT University in Melbourne. I finished my degree about 3 years ago, and I'm doing my Masters in International Development at RMIT University.
I'm here now with
in
Yolanda.
Melbourne.
Yolanda has a very, very important job in this clinic. She's the finance officer. And the matter of money is very sensitive because donors aren't going to give, governments aren't going to bless, if you like, an organisation that doesn't take good care of money. But in this place there are many, many stresses, and people like Yolanda, who often doesn't get her sleep at night just to get reports organised for various donors and so on, I ask her what keeps her going, what motivates her.
I'm stay here for the people. This is all about the people. And some people say that this is only paper and then make me crazy like that. The clinic Bairo Pite free for everyone, free for them. If like that, I must work hard for the people. If not, money didn't come because we cannot have money anywhere. For only me, I must to do this good for the patient, for the donation, to find money for people poor.